We are wanting to bring you the latest information on the COVID-19 virus. We call this a pre-game show or pre-show. I guess we shouldn't call it game, but pre-show. And the reason is because we can't yet call it a pandemic. So it's like the pandemic pre-show. You know, like the Super Bowl has its pre-game show. This is the pre-game show for the pandemic. It's not yet a pandemic, and the reason is because of the definition of pandemic. The pandemic definition requires that there be an extraordinary number of infections all over the world compared to whatever the normal level of a certain infection is. Well, this is new, so of course any infection is more than usual, but in comparison to the whole population. And when you look at most countries in the world have actually a very small fraction of their population affected by this virus. That's why the World Health Organization and CDC haven't yet used that word pandemic. It is most likely coming in weeks to months. If it gets worse quickly, weeks. Now we are seeing cases just growing at an exponential rate across the world, although not in China, the country where this all started. We now have the COVID-19 virus in over 102 countries and 113,000 cases as of this afternoon. Italy is especially hard hit. Since we last talked about it, or last information that came out before the weekend, now after the weekend, we have a number of 1,247 new cases. And 99% of the new cases over the weekend are actually from countries other than China. China actually has good control now on the rising count of COVID infections. And they have a lot more recovered cases than they have active cases, which is unlike most other countries in the world where they don't have that many fully recovered cases counted. Iran, interesting, a little bit of news from Iran. They released 70,000 prisoners from jail and prison because of the concern for infection spreading in those very tight environments, very dense population. And you hear our door, yes. Man. Dr. Gwaine, welcome to Auburn Medical Group YouTube channel show.
I was doing my
Thanks for joining us.
My day job.
Your day job. He has a day job too. He sees patients.
I do have one of those.
So I was just going over some of the facts that, we talked about how Iran released 70,000 prisoners because they didn't want them all just spreading the disease in the prison, in the jails.
I did not know that. That's
I didn't know they had 70,000 prisoners. To me, that was a little, I don't know. Are they a big enough country to have that many? Or do they just like locking people up? I don't know. A little concerned. I'm wondering if any of them were journalists, though.
Oh, good question. Who knows?
You know, all those journalists that they
always
keep wanting to release. Yeah. They accuse them of espionage or whatever.
Right.
And, Okay, so what other things do we have to talk about? We have also the United States update. You ready for the U.S. update?
Yeah.
So,
This is as of when? Because it's updating.
I'm coughing.
Where's my mask?
Put a mask on the
Find it. Where's the N95?
Excuse me. Sorry. Okay. I was just so choked up. All right. Back to.
So you said U.S. updates. So this is as of
this afternoon.
This afternoon. Fairly up to date here.
March 9th, 2020. Okay. So 605 cases in the U.S. and how many deaths? 22 total, with 18 of those being in Washington.
Yeah, Washington's
quite the cluster
hard.
There with that.
Yeah. Right around Seattle.
Yeah.
So
nursing home.
Yeah, that was the nursing home that got hit, and unfortunately, that's the population that is getting hit hard by this and dying the most. I think. Did we talk about some of the rates of death in the older people? So over age 70, the rate of death just skyrockets. So 70 to 80, the rate is about 8.6%. Over age 80, 15.6%, I believe. That is just a crazy rate.
So
now these are evolving numbers. That's just the most.
They're actually going down
one.
as we
Some of those are
get into countries with better health systems.
Right. Yeah.
Yeah. One of the things I wanted to point out was people look at those numbers and they say, well, gee, if you were to watch the news, and they're probably talking about us too, you would think that the death rate is way higher than 15% or 14%.
Yeah, that this is a scary thing. Well,
but I want to put it in perspective. That's not that much better than playing Russian roulette.
15%, yeah.
And how confident do you feel to do that?
Right. Yeah, so if we're talking, so the numbers are like evolving weekly here. The WHO recently put the number at 3.4%, I think it was. And that's the most recent one out of China, with most of those cases in China. And that breaks down, to males and females, and they actually say it's a little more predominant in males. But apparently in China, you're much more likely to be a smoker if you're a male. So they're not sure if it actually is more deadly in men than women.
Men smokers.
Yeah, male smokers in China are the predominant people who are getting hit. So.
And with looking at the fatality rate in South Korea, we have this idea that maybe places with more advanced health systems will have lower fatality rates. Or it may be that a place like South Korea is better able to test people who are less symptomatic than they were testing in China. And we've been saying pretty early on, not from the very start, but pretty early on, that we expect the fatality rate to look like it's lower as we start to account for more of these people who are very low level of symptoms or even no symptoms, totally asymptomatic infections that we're not going to know about in this country for quite a while because we're still not to the point where we test asymptomatic people.
Right.
And we are going to talk about testing in the U.S. here in a moment. Some other news here, we want to make it a little closer to home for us, and that's California.
Well, really quick, while we're still talking about the death rate, I wanted to, we kind of have this natural cohort that I actually heard this on a recent podcast I was listening to of CME, medical education. But they were saying we actually have this little cohort of healthy people with one of the, what's it? The Grand Princess? The Princess?
Yeah, Grand Princess.
Yeah, so it is its own little cohort study of healthy people. Obviously, you're not going to go on a cruise if you're unhealthy or old or unable to do it.
Or on oxygen.
Or on oxygen.
Well, I guess they could, but...
Unlikely, yeah, but I guess. But I don't think any of those went on this. And in that, the death rate was much lower. I think it was about 1%. So.
Of the people who are infected.
Yeah, so a little cohort study.
Oh, over what? How much time though? Do they have enough time to have the full course?
We don't have the full course yet, but that will be interesting to see how that bears out because that was a healthy population that went on there. So it'll be interesting to see. So, anyways, back to where you're at.
So yeah, that's also off the coast of California. But what I want to say is 114 infected in California cases as of this morning. 1 death in California, here in Placer County.
In Placer County, where
in Placer
we are
County.
at.
And we do have cases in Placer County right now related to that case that came in on a cruise ship.
Right.
And then also, Elk Grove School District.
Yeah, my wife texted me that actually this afternoon. So that's, 30 miles away from here?
Yeah, so it's actually where we get our medical students from is Elk Grove. So very much the area that we're in. And of course, we know that Washington and Seattle areas has closing, and University of Washington trying to go all online here with
they're doing some drastic changes.
Very little notice. They just shut down the campus, huge, major university campus. Okay, so I was explaining why this was the pre-show.
Oh, okay.
That it's not actually a pandemic.
We can't call it that.
We're bringing you a pandemic. I shouldn't smile when I say that.
Brought to you by. This sounds horrible.
By Lindsay Antwine. Blame her for it.
Oh man,
she's the one that made this happen.
It's a good way to.
That's the way to honor our sponsors and our channel members. Perhaps this would be a good time for us to promote channel members. Nay, maybe not.
No.
Okay.
No.
So one of the things we want to do, since it's like the pre-show for COVID-19 pandemic, help you guys get prepared for it, which we've talked about quite a bit. We want you to be doing things, healthy habits, to make it less likely that you would get infected or that you would pass it on to somebody else, because somebody eventually that gets it, when people pass it on, is somebody who's going to be vulnerable, in the vulnerable population, elderly especially, elderly and those with chronic disease. So if you're not that, in order for you to not be a problem of being in the chain that passes it on to them, we want you to be washing your hands. And I have found that in meetings I've gone to at church, that people are totally with this thing of not shaking hands right now.
Yeah.
And so
they're okay
at first it was fist bumps, and then people thought,
even that is getting a little close.
We're still touching the skin, and so now it's kind of turned to elbow bumps. I'm okay with greeting people with elbow bumps for now. We'll get back to human touch, which is important. Just if we can, put it off a little bit here, at least in the general public and in casual settings. Let's go ahead and keep a little distance with our greetings and our gatherings for now. This is temporary. I'm not saying anything about changing our culture forever here, but just for right now, let's let it be the cool thing to not shake hands and touch knuckles just for now. You okay with that?
Absolutely.
Okay. The other thing I want to do is have people, wash your hands and not getting close to each other, trying to maintain a distance of 6 feet if you can, especially indoors, because somebody could be contagious before they're symptomatic and be dropping aerosol particles around on surfaces that you touch. So that's the other part of it, is cleaning the surfaces with wipes, Lysol wipes and Clorox wipes. Those seem to be adequate to get rid of the virus. Using, when I said hand washing, go ahead and using hand sanitizer, alcohol-based hand sanitizers for when you don't have soap and water to wash your hands with. Those, we believe, will kill the virus. No reason not to think that it won't. What else do we have? Surfaces, hand washing.
Don't touch your
face. Don't touch your face. That's right. Eyes, nose, mouth.
That's where it gets in.
Don't touch it. There was a video over the weekend of some official telling people not to touch their hands, nose, and face. And then she goes and she touches her finger and then, to move the paper. You know how people will do that? I don't do that. I can't understand it. I can't.
Licking your finger to
licking your finger to some people. It's like their thumb. They go like this. Every paper to every student as they're passing it out. Never done that myself, and just start people are doing that. Yeah. Don't. If you're a person who does that, come up with something else. So, what else besides those just personal hygiene and safety things? What else would we want to tell our folks about how to deal with this?
I've been telling my older patients, 70 and older is what I'm considering older, that they probably should put off any travel at this point. Okay. And even to the point of maybe not going to crowded places for a little while. And I'm not trying to incite panic in those people. That's just the vulnerable population. So I had a gentleman in today who has CHF and COPD. Those are both heart and lung conditions, which make him very, very susceptible. So I was advising him, just don't do it. I had another person who had a cruise planned to Norway. I said, don't do it. Cruises are actually suggested against by I think it's the World Health Organization says don't go on a cruise at all at this point, considering what we've seen. So that I am actually advising my patients to not travel at this point, at least until we have more information. Now, most of these travel dates are, in the future, 4 weeks out or something, and we don't know where it's going to be. So I'm just saying, hey, take it easy. Let's stop all unessential travel. So I don't know if you're advising your patients the same, but
yeah, I am. Yeah, for right now.
Yeah.
Just let's see. And it's because travel is usually on airplanes or boats that are very crowded. If it's you in your car to go visit your family in a state that doesn't have any cases of COVID, go for it.
All right, go for it.
Enjoy it. Time for a road trip.
Yeah, and I haven't told anybody to stop doing that. Yeah. Younger people, I haven't really given any bigger advice than wash your hands. Do basic hygiene stuff.
My children wanted to travel over spring break. Well, they're traveling in places that have fewer cases than the U.S. or California if they're in the U.S. So, except for the airplane
You'll
part.
You'll actually be safer over there.
Just go ahead and go to that country or that state because you have less cases than we have here.
What about masks? Maybe talk about those a little.
So masks just aren't all that valuable outside of the setting of the doctor's office for healthcare practitioners who are right there in it on purpose with people coughing. It's just not worth it for what it takes to get a good seal. And besides, they're not available outside of the healthcare setting for the most part anyway. So what do we do with masks? Well, when people come to the office, we ask them to wear a mask that's not all that great, but will catch what they're coughing out because it'll catch any respiratory droplets inside of it. And then what comes out hopefully is just air out the sides if you use the little surgical mask that we use for patients in the office. And if you were going outdoors and you have symptoms, yes, please have that. But more importantly, please don't go out in the first place unless it's to the doctor's office, and we'll give you a mask here. Just a little update for people who don't know what's going on at doctor's offices. For the most part, they're doing what we are, and that's coming up with a program where you can catch people who have cough, shortness of breath, sore throat, with or without fever. Catch them before they even enter the building and put a mask on them. And in our office, we actually ask them, go sit on the bench or go back to your car, and we'll call you when the MA is ready to take you into an exam room. And we have an alternate route around our building. So these people don't even go in the waiting room at all. They totally bypass registration in the waiting room, go directly to an exam room, and then we wear gown, gloves, eye protection to do their assessment. We're not yet testing. Right. We expect testing possibly as early as tomorrow in our office and other offices, but we don't have the test kits yet. Actually, we haven't ordered the test kits yet, but the labs will have the tests ready to go this week. In our area, I suppose that's true for most of the country. I don't know. But we will be doing testing of, not of everybody, just of those people who are especially high risk. Even not all the people with symptoms at this point, because there's just not enough tests yet. But people who are especially high risk either for their own health, or they're especially likely to have been exposed because of the cruise ship or travel, or people who are around a lot of people, and so they're at risk because of that, like the checker at Target or restaurant wait staff or school teachers, people who are just always around large groups of people. Those are the ones that, if they have symptoms, we're going to be testing them first before we test just anybody for it. Do you have any comments or questions off of the YouTube there? Because this is live, and you guys are
let's
calling into the chat.
Kind of talking a little bit about our
especially
perspectives.
Our channel members.
Yeah, Bianca says there's 19 deaths in the UK. She's staying apprised of where she is at, and you probably, wherever you are, should be checking the map, looking at your local statistics, just for your own education to know where it's at and how prevalent it is in your area, which unfortunately around us is a lot.
Yeah, we're kind of...
Somebody says Italy is quarantined. I don't know if you commented on that.
Yeah, Italy's quarantined.
Essentially cut off Italy,
goodness.
Closed its borders. So we'll see. Let's see other things. Somebody says the face masks for normal use just going around is pretty useless, and yes, that's pretty true. Just practice normal hygiene and avoid people. If you have a 6-foot radius from somebody, then you'll be fine. Let's see here. And wash your hands. That was reiterated multiple times.
Yeah, you mentioned the 6-foot radius. Not just the radius, but also the amount of time you're either in the same room with them or in the same area as them. It's a combination of time and proximity.
Somebody is asking, how are different viruses transmitted different ways? It's a pretty good question, because we talk about some viruses that are airborne, get in the air, and some of them are respiratory droplets, like this one. And it's just where it lives, I guess, is that the best way to describe it?
In the body?
Yeah, and how it comes out. So somebody who's coughing, and this is in your respiratory droplets, it's just going to come out and then drop down. Now, that being said, it can live on surfaces, and we have to go through a whole process. If there's any suspected case in our office, we have to clean it down and actually let it stand for an hour, I believe.
Yeah. No, you let it stand for an hour first, then wipe it down.
Oh, yeah, that's right.
Because you want all the particles
and then you gotta let everything land. So it's not
time to land.
Yeah, airborne. It drops down, and then you gotta wipe everything down. So it can be quite the burden on a small office like ours.
Well, if there were a lot of cases.
Yeah. If there,
as long as they just come in an hour at a time, we're good.
We've only got how many rooms? Anyways. Yeah. So yeah, great question. I don't know who that was, but great question on how they're transmitted differently. Okay. Yeah, that's about it. Thanks for all the...
Okay.
And just to call out our channel members, Bianca, thanks for watching. Laura Spurs, who comments, it's amazing how much we touch our faces. True. It's actually 5 times already. I've been counting. I've been wanting to touch my face while on the video because I've got an itch or something, and I've powered through it.
If I ever touch my face on the videos, just light up the comments to let me know I did it. Yeah. So I know I'm doing it. Oh, man.
Yeah.
So I was also going to mention our merchandise on the channel in case people want to have our pictures on a mug or something like that. Or if you wanted to have a T-shirt, this is Auburn Medical Group.
You can't get enough of us.
Or if you wanted to have a poster with a meme about COVID-19, yes, I am that distasteful that I made a meme of COVID-19. Too soon? For some of our viewers, yeah. Sorry.
That's fun.
So, but if you want us to show on our show, you with our merchandise, let me know on Instagram. It's at Dr. Vaughn, and you can either send a message or put at Dr. Vaughn in your comments or your little description, your caption of your Instagram, and then we'll put it on the show for you.
Yep.
All right.
So what's the summary? We're not light your hair on fire scared, but we are concerned about where this is going to go, especially if you are a person over 70.
Yeah, vulnerable populations, there is concern.
And that's why I'm making changes in my life to help protect those people over age 70, and so should you.
Yep. So
there
anybody you want to thank?
Absolutely. So I got another post up over at drgreenknight.com. That one is on CHF, congestive heart failure.
Excellent.
I was just completing my little series on heart disease, and I do want to thank Boo Boo Kitty and Teresa Wallet. Thank you for supporting that. Appreciate it.
And also thanks to Lindsay Antwine. We mentioned earlier that she's responsible for this pregame show for the
she makes
pandemic yet to come.
She didn't make COVID-19 happen. No, we're not saying that.
We will get through that. That's the bottom line is we'll get through this. Take these measures to be as safe as you can. And, it's going to be a long journey before this is all